I recognize a face. How
Hi,
are you, Nadia?
I'm doing good. How are you? It's nice to see
Good.
you again.
Yeah. Everything going well so far?
Yeah, I'm a student, so I'm getting good grades.
Good.
Well, welcome everybody. We're going to get started in just a minute or two. We're letting everybody load in. My name is Mary Cobra. I work in the Career Center, and I am super excited today to be bringing Dignity Health with you via Stephanie Rake. Before we get started, though, I just want to encourage you all. This is going to be an open forum for you. Stephanie certainly has a lot of great information to share with you, but she also wants to hear from you. So please feel free to turn on your mics when you want to speak and to have your video on. You're more than welcome to do that. I also encourage you, as questions come up, if Stephanie is speaking, to please put it in the chat, and we'll keep track of those and make sure that your questions get answered, because that's what we're here for. We had a pretty good response to this, and students from a variety of backgrounds, Stephanie, just so you know, and majors. So I'm sure you're going to get a variety of questions coming your way. Alrighty, so let's see, just want to make sure we're not missing anybody in the waiting room. Okay. Again, this is Mary Cobra from the Career Center, excited to introduce you to Stephanie Rake, who does recruitment for Dignity Health here in the Sacramento region. We have worked with Stephanie before. She was on campus last year, so we're super grateful that you come back to us, this time virtually. So I know we can't all kind of come up and chat with each other, but we have this venue, so we're going to make the most of it. So Stephanie, I'll let you take it away.
Okay, sounds good. Well, hello, everyone. There's no need to come onto camera, but I do like to see your faces, so hi. I think what I'll probably start with is just a quick introduction about myself. I have also been a student with Sac State, and back in 2002 is when I was finished. And I have been with Dignity Health since 2003, so there's a correlation between school and work. But from there, I have moved within the recruitment and human resources department of the organization. So I've held multiple roles, but I really liked recruiting best. It's a lot more fun to help people find jobs. So I stuck with that. Does anybody have questions about my intro? Okay.
Stephanie, quick question. What did you study at Sac State?
Oh, marketing and communications. I honestly thought I was going to go into public relations, but I never went that route. I had a couple of jobs where I got the experience before I joined Dignity Health, and I actually applied to a job with Dignity Health's PR department. Um, and then they did the interview and recommended me to the talent team, and that's kind of where I went the recruiting path. So it was very strange journey, and your mind changes a lot when you're in school because you get interested by different subjects, and it might lead you into different paths than what you originally started with.
Okay, thanks.
Mhm. So a little bit of information about Dignity Health, if you're not familiar with with our organization, we
Kind
have
of.
we have 5 hospitals within the Greater Sacramento service area. The Sisters of Mercy first opened our hospital in the Bay Area in the 1800s, a long, long time ago, which eventually became multiple sites when they came to the Sacramento area in the 20s. I want to say like 1922. I'm not very good at history. It's not my specialty, but I think it was early 1900s. They built their first hospital where the SACB business now sits, which is 22nd and R. And then created a larger hospital, which is now Mercy General, and that was in the 70s. I want to say 75. So fun fact about Mercy General, it was the second hospital, but eventually was the only Dignity Health hospital in in our region because the R Street location eventually became the SAC B, and the cornerstone of that SAC B location is still the cornerstone of our current Mercy General building. So if you ever walk by and you see this Latin number stone right by the front door, that's why that's there. Since the 80s, we have grown to the 5 hospitals. We also have 30 clinics in the area. Let me see. Sorry, I've got a racing child in the back. Sorry. Um, 30 clinics in the area. Oh, and we are currently growing into Common Spirit Health, which will not only have us in the Sacramento area and throughout California, but will be nationwide once we connect with CHI, which is an East Coast and Midwest hospital system. Once we connect together with all of our policies, procedures, values, and mission, we will be a nationwide company, which you would be able to transfer within and throughout, which I think is pretty cool. Any questions so far? All right, you guys are easy peasy. So let's see, a lot of questions I get about our organization are, well, what are you hiring for? And that is kind of a hard question because at any given time, we are hiring for everything. We employ, well, actually, I have real data on this, so let me grab it. We currently employ 15,000 employees throughout the greater Sacramento service area, and at any given time, someone is transferring into or out of, or new positions are created. So it is a constant, we're constantly posting positions, and a lot of the titles are clinical, but we have a lot of non-clinical titles as well because our corporate office is here. From clinical to clerical, licensed and non-licensed, and everything in between. I mean, you really can find, potentially anything to match what you're looking for. Oops. I have another one that I want to pull the data for. The nice part about this virtual situation is I can quickly pull up our fact sheets and find information. While I'm looking, does anybody have any questions?
I see 2 in the chat, Stephanie.
Oh, great.
One is, what are the company values, for starters?
Oh, well, so our mission statement actually it's a 5-part. Oh, I've moved the mouse around. There we go. Back on. Our core value is dignity, of course, holding a person's inherent value and worth to the highest degree. We want to treat our patients, our teammates, everybody in our community with dignity. So that's one of the reasons why our organization did change its name to Dignity Health, because we wanted to make that kind of our. We hold teamwork as a highly valuable resource for our organization. Like I said, we have 5 different facilities here and we have multiple clinics. And if we don't work kind of all together, we could be doing double work, or we could be just inefficient. So we try our hardest to work together and get things done as a team. Let's see, it's kind of a test because I can't remember all of them off the top of my head. So there's dignity, teamwork. Another one is the goal of serving the underserved. We have a lot of community connections. We partner with Loaves and Fishes.
Excuse me.
Yes.
I'm a healthcare administration major.
Mm-hmm.
This is my final semester here. So I'm asking, do you still have openings for healthcare administration positions?
Well, that's a hard one. that particular degree program, we don't have a title that says healthcare administration. So within multiple postings, you may find that it prefers to have that as a qualification. The best advice I can give you is when you're searching on our website for positions, type in the acronym for your degree and it will give you a complete listing of every job we've posted that also includes that acronym, which would be, what is that, a BHA? No. Yeah, I think it's BHA. Mary, will you help me out on that? What's the acronym for that degree?
I'm not sure either.
Okay.
Perhaps a student can help us with that.
Also, you could just do healthcare administration and it would pull
Yeah.
that up.
Yeah.
Generally, anything in the corporate office or business office would probably benefit from that degree. So maybe starting there too, if you're just looking for locations. But as far as titles, I mean, that one is much different than an RN. It's a really flexible program. So you can go finance or you can go HR or you can go hospital administration. It just depends.
Thank you. We got a BHSA. Okay, that's what I thought.
Uh,
From Jasmine, thank you.
Thank you, Jasmine.
On that, and kind of along this same thread, there is a question in the chat. What experiences do you need to be employed? I know that's a broad question.
That is a broad question. I mean, we have positions that require 6 months experience just in the healthcare environment. It doesn't specify whether that's clinical or not. Actually, Nadia, can I pick on you for just a moment for the screener title? Yeah. Okay, so I'm going to use this title as a specific example because it's been very interesting. We created a new title for our community called an entryway screener. And essentially it's asking for 6 months of healthcare experience. So Nadia is one of those candidates, and while she's going to school, we counted her clinical educational experience as healthcare experience. So although it's not a paid job, actually, I'm pretty sure you actually had experience too.
Yeah.
Okay.
Paid.
So, if we see that you are in your third semester of nursing school, but you have not worked as a nurse or in a healthcare environment, and it's asking for 6 months of experience, you're hands-on doing the work through school. So we would consider that experience. It depends. There are other titles that specifically say requires 1 year of experience as a financial analyst or as a ultrasound tech. And in those cases, you'd have to just show on your resume that you've worked in that type of position to show the qualifications.
I'm sorry, but I have a question with the work experience because I did volunteer.
Mm-hmm.
Would that be as an experience? Because I volunteered at the Marion Medical here back home. Would that be considered an experience as well, or no?
I'm going to come back to that screener position because it doesn't specify the specific title. It just says healthcare. I think a lot of volunteer experience could be counted. It would truly depend on what you did. If as a volunteer you answered phones or responded to inquiries, that's more of a clerical role. So in cases where it's direct patient care experience or direct healthcare patient experience, it may not match well with that. But if it said 6 months of administrative work or 6 months in a clerical environment, and you were there for a year, I'd say that would match. I would definitely look at your application as qualified if that was what we're looking for.
Okay, thank you.
Sure, yeah. Any other questions? It looks like there's a couple of chats on here. Let's see.
There's a question, are there volunteering or internship opportunities for undergraduates? So, yeah.
Oh, absolutely. Finding the title that matches is probably less title and more status of hours. While you're going to school, it can be really difficult to juggle a full-time job, your educational responsibilities, and just having a life. So matching not only the job title and what you're looking for and what the company's looking for with what kind of shift or how many hours you'd be working is really important. We do have supplemental and per diem titles, which are really great for this specific situation. If you're looking for a couple of days a week or maybe even a couple of days a month, taking a supplemental or per diem is kind of the way to go. You give up your availability to the department, and as the department has needs, they call to see if you can work. So yes, I would say that would be a really good, I guess, position, not paid position, for undergrads. If you're looking for something more full-time for a volunteering or internship, we have a whole volunteering department. So yes, but internships, we don't have a lot that aren't tied to a specific program now. So whatever program you're in, you may want to talk to your advisor to see what internships are available out there.
More questions, Stephanie. They're coming in.
I love it.
How much experience do you need to be hired as a safety specialist?
A safety specialist. I don't know. I don't have that title in front of me, but I could take a look. Let's see. So I'm assuming there was a position posted. Who asked that one? Let's see.
That would be Santa.
Santa, did you happen to see this position posted somewhere, or is it a title you've heard of?
Yes, it was actually in the previous semesters, Dignity Health was offering internships in the health and safety department.
Mm-hmm.
So yeah, that's what I was because I was trying to find the information on how many years of experience you need in order to be hired as a safety specialist, and I see that it varies from hospital to hospital. So I wanted to know how much experience Dignity Health required. Kaiser requires 3 years.
Okay, that's a great question. Generally we have standardized job descriptions. So where one site, let's pick on Methodist. Methodist says, I need 2 years of experience to be a safety specialist. Then all of our sites in the region should be exactly the same. And the reason for that is transferability. We want to make sure that if you're working at one location and something happens and you maybe move to Grass Valley, or you no longer want a commute from Elk Grove to Rockland, whatever it may be. We want to be able to give you the opportunity to transfer without having to go back to school and or get additional certifications. So they're usually the same in our region. I cannot speak for the organization as a whole, but generally, if it says 1 to 2, then 1 to 2 is probably pretty standard for our area.
There's another question.
Okay, thank you.
Oh, sorry. That we may need a little clarification for because it came in during the discussion. And the question is, even now that COVID is still around. So this came from Ariana, so I don't know if we need clarification, but maybe addressing what's different, what's still available in person versus as you're working remotely. It's a good question, yeah.
So with our current situation, a lot of things have changed. We are trying to minimize the amount of people that are coming in and through the doors as we can. I don't believe we have a current volunteer program going right now. I do know that we have plans to re-implement that when it's safe to do so. But as far as I recall, and this is my bad, I probably should have looked at the newsletter. They send one every week to tell us what's going on, and I did not for the past couple of weeks. But as far as I know, if you are not working on shift and or visiting a patient that day, or are there for, some sort of procedure, then they are not allowing additional members of the community to come in to the facilities. So that is a good question. If you are looking for volunteership right now, it may be pretty slow.
All right, to shift gears a little bit, we have a question here. What are hiring managers looking for in resumes and cover letters for RN vacancies?
Ooh. Well, I love talking cover letters and resumes. I don't believe cover letters are always necessary, but if you see that a job description is asking for it, please just do a paragraph, something small, doesn't take much time. And the specific purpose of a cover letter is to quickly summarize your resume. You want to point out the things that they're looking for right there in the first paragraph. You know, hi, I'm applying to a new grad RN position. I recently graduated from Sac State, and here are my clinical rotations. Here are the licenses I've already received and the ones that I will be getting. You know, regards, Stephanie Rake. As far as the resume format and structure is really just subjective, you know. For the most part, as long as everything's really easy to find, and when you look at your resume, it's clear and it doesn't have a whole lot of like flair, that's perfect. I mean, if it has a photo or some sort of filigree on the side, that is also fine. If it's something that uh, is pleasing to the eye, whatever you put on there is perfect. Um, as far as the information, I mean, whatever you've worked hard to achieve, whether that is a license, the education, certification, make sure that that's on there. You spent the time to get it. You got to kind of shout it from the rooftops. You want to advertise it. Um, Job experience wise, I say always go into great detail about relevant job information, but if you have not yet worked in the field and this is a new position to you or just a new position in general, a quick summary of your volunteer experiences and the skills that you've learned from that are a really good thing to put on there. But there isn't like a magic information algorithm or a magic um, setup that everyone, every hiring manager is looking for. It's, you know, really subjective to whatever the position is looking for. If it's an RN in telemetry, you know, they want to see your experience if you have it, and if you don't, they want to see what clinical rotations you've done, um, and that's pretty much it. They just want to know, like, well, what are you bringing to our team? What can we give to you for your experience? And yeah, that's it in a nutshell.
And there's a question right under it that is kind of along the same lines. And I think it says, how can we make our resume applications stand out? So in this competitive job market, all things being equal, what do you recommend that they do to stand out, regardless of your background, or if there's any tips or tricks or things that would be helpful to explore?
Well, I mean, for me, if I were to apply to a job tomorrow, my tip, my trick is to using the job description that is posted. I would take keywords that they've used and simply put them in my resume. You know, if they say they're looking for a dynamic public speaker, that will probably be in my objective, a dynamic public speaker looking for a public speaking job. Um, other than having kind of a match to what they're putting out there in the world, I would say to make it as clear as possible to whoever is reading this, what you've done and what you have experience in. A lot of industries use programs or software that are really proprietary to that organization, and we may not be familiar with it. It could be an exact match to our you know, applicant tracking system that we use, which is a program called iCIMS, but it goes by other names. You know, Sutter also uses iCIMS, but I think they call theirs My Career. It's the same exact program, but because it's used by a different company, it has a different name. And we may not know that. So if you list iCIMS and I use My Career and I'm looking on your resume for that skill, I may overlook it. So treat us, the poor poor recruiters, as if we have not researched anything and we don't know. So give us as much information as possible, and that will help us identify very quickly your qualifications and get you right in front of that hiring manager, which is the ultimate goal.
All right. More questions. What are the requirements for office support positions?
Ooh, well, we have many. I think when most people think of working at a hospital, they think, oh, I have to be a nurse or I have to be a doctor. But we actually have more support roles than those two roles. So depending on the department, it could be 6 months of customer service. Customer service is usually a general kind of blanket qualification that we want because our clerical roles are speaking to the public. And in some cases, they're connecting with the public in a stressful situation. Most people don't go to the hospital for a good reason. So having that skill is really important, and so it is usually one that we're looking for. And it's kind of hard to relay in a resume, but we can tell if you've been in a multi-call center environment that you probably dealt with your fair share of people also in stressful situations. So that's pretty clear. Another possible minimum requirement would be maybe 6 months to a year of just overall office experience, working not only with the public, but working with phone systems, communication within the team in an electronic environment, such as emails, your Word, your Microsoft, your Excel, that kind of thing. What you would think of in any office is pretty much the standard for any business. You have these tools. What you do with those tools may be different depending on the job, but for the most part, if you're in an office environment, you're going to use these things, and so having experience with them would be helpful.
Right. And a few more position-specific questions. One asking if there's any positions available for finance department. And another, are there positions for health educators or educator assistants?
So I'll start with the finance. We do have a finance department, but here's where it gets hard. So we have a whole team that just works on the finance for our region, and then we also have finance titles at each facility. And the reason why is the team in our corporate office will meet with all of our facilities and our clinics to discuss the financials and adjust or reallocate things as needed. So where some companies may have a finance department and that's it. If you work in finance, you work there. We have multiple titles throughout. Generally, if you're looking to go that route, any title with the word analyst will be associated with that. But we also have a whole category on our website that you could drop down and use called finance. And it includes our business analysts, our financial analysts, but it also includes our financial counseling reps, which work with our patient registration when you come into the hospital and, check in and get your details for your appointment. You also provide either your insurance information or work out some form of payment plan, and our financial counselors are the ones that would assist. If you do not have insurance or you're unsure of options available to those that are uninsured, they would be able to research that for you and give you options and figure out which ones you might qualify for. And then, health educators, I almost forgot that one.
Yeah, it was health educators or educator assistants.
So I actually just filled a health educator. We don't have a lot of them. And it's just because of our times. We're still trying to figure out how to create health education classes in a virtual environment. So I imagine we'll probably have more coming soon. For the most part, we have, again, a category on our website that is just for educators. And it ranges from clinical educators who will assist in keeping the licensed folks ahead in their own titles, sharing information, helping keep their CPR cards renewed, or training them on the new software programs or tools that are available to them in a clinical environment. And then we have health educators and educational support staff that will go to our communities and create kind of a mini conference or a mini classroom where they're educating about diabetes management, healthy eating, or anything along those lines to help our community stay healthy. And I mean, as silly as it sounds, we don't want them to have to come to the hospital if they don't. So if there's a program or information that we can provide to keep them healthy and doing their thing, then that's what our educators will create and educate about.
Thank you. And one of these questions is sort of already addressed, knowing if hospitals are allowing volunteers due to COVID-19, but there's a kind of another question in there that's asking along those lines if there's teleworking opportunities. Maybe if you could just address sort of how these jobs break out in terms of who's working from home and
Sure.
what those opportunities might be.
So it is a strange new world. For the most part, anything where, if you can imagine, they would be assisting a patient or registering a person, it is still done in person. I mean, I believe that there are telehealth nurses, and they may do more question and answer, and that would be at home. We may have virtual visits for a lot of our clinics so that they can see their primary care physicians via video calls. But if you are an ICU nurse, you're coming in to the hospital because your patients need all of the equipment there. But if you what else? Of course, everything that goes along with that. So you would have anyone who cleans the room, anyone who sets up a room, anyone who brings food to the patients, anyone who may need access to our pharmacy to do their job. So pharmacists, pharmacy techs, a lot of our physicians who may have pharmacy requests would probably have to come in and do it. A lot of things need to be signed off in person. So it kind of depends, but it is always a really good question to ask, during that interview process, is this an opportunity to work remotely or to telework? And it could be as much as 50%, or I'm sorry, as much as 100%, could be 50%, or it could be, unfortunately, no, this position is in person. So it depends.
And just for my own curiosity, of the finance opportunities, everyone there is remote at this point as we speak, or is it kind of a mixed bag there as well?
You know what? I don't know.
I'm just curious.
For our corporate office, we are able to go in there and work from our desks if we'd like. So I would imagine that department probably has the same rules as ours. If there's a business need to be there, maybe you have terrible internet, because it's still a thing out there. Slow internet is a hassle. Then you can come in and work within the building, no problem.
Some more nursing questions. Do you have any RN new grad programs coming up?
I love that one. We do. We generally will time it out along the graduation dates, which, what are we, in October? So we probably will have some postings coming up near the beginning of September. Let me see. I just pulled the numbers. So, so on average, it looks like each site will hire anywhere from 3 to 5, which doesn't sound like a lot, but we do have 5 facilities here, so that could be 15 to 20 new grads from our area. If you have clinicals with one of our locations and it's a department that you really enjoy, before you move on to your next clinical rotation, get that person's contact information and stay connected. So when that job is posted, you'll have a direct link. You can bypass me all you want and go right to the person who's making the decision and send them a note to say, hey, I did a clinical rotation with you in 2018. I just graduated. I saw that you have a posting and I've applied. That is probably the best advice I can give to anyone in a new grad situation right now, because ultimately the goal is to get in front of the hiring manager and have the hiring manager choose you. So why not get in front of them faster with a message?
Great advice. Thank you,
Mhm.
Stephanie. And here's a really great, slightly different subject. Great question. What is the hiring process like? Rounds of interviews, timelines, etc.
It can be rough, depending on the title. For the most part, staff level titles, it will be once you apply, I will review candidates. Our organization kind of has a service line agreement where we make a kind of a pledge that when you apply, we will spend no more than 24 hours before your resume is reviewed and moved on, or reviewed and notified. In some cases, it can take us 2 days, 3 days because of the weekend or the long weekend. But for the most part, we're looking at your information right away to see if you meet the qualifications. And then from there, we are kind of waiting for the hiring manager to tell us what's going on with their timeline to create calendar bookings for interviews. With everything that's going on right now, it is a little bit faster, surprisingly, because everything's virtual. So instead of having to connect and find a conference room and figure out a good time for people to travel, now we can meet instantly in a virtual environment. So if it's a staff level interview, once you've been reviewed for qualifications and sent to the hiring manager, you will probably have one interview, and then that person will, once they've completed, will decide who the chosen candidate is and then make that offer. So if you apply today, what is today, Tuesday? And I look at your information tonight or tomorrow, the manager decides, oh, of this group of candidates, I'm going to interview these 5. And they do that on Friday, you could very well have an interview set up on Monday and a job offer on Tuesday. So it's very quick now. Now, the higher level titles that you go up, it is not very quick. One in particular, I have a marketing manager title that is, it is 6 rounds of interviews because they will be working with multiple facilities in our area, and each hospital president would like time with that candidate. So unfortunately, there are 5 hospitals, and so 5 different Zoom appointments. And then once, not to mention the hiring manager has to interview you first. So it can be a lot depending on the title, but generally we try to make it as painless as possible if we can. That one is just a hard one, so it's probably a terrible example to give, but it could be 1 up to 6. It depends on the title.
All right, from what I can tell, all of the questions that have been in the chat have been answered, and I know you were kind of almost just getting started when everybody jumped in with questions, so I'm sure there's probably more you want to share, and we'll keep our eye on the chat.
Okay, let's see, I'll give you guys some fun facts. So the Dignity Health is involved in our community in multiple ways. I think for me, my favorite community involvement, because it's something that we get to assist with, is being able to volunteer a couple of times a year on the clock, which is nice. So yes, you're spending time free for the company, but you're still getting paid. But I love going to our local food banks and working with my teammates to sort and get organized for their deliveries. I love our food drives that we do within our department. We also sponsor, I think it's like the halfway mile point of the California Invitational Marathon. So you'll see a big Dignity Health banner there if you're into running. Let's see. I mentioned loaves and fishes earlier. If anybody is unfamiliar with Loaves and Fishes, it is a support network for our local homeless population. They offer sanctuary, they offer meals, they offer clothing. We also put together little toiletry bags for them, which, you know, just a little piece of comfort, like clean socks, a fresh toothbrush, a comb, things like that. It's really wonderful. It's all provided by our organization, so we don't do drives for that. It's just something that's given back to the community. Um, what else? Oh, well, this is a really fun fact for me because I've watched this person progress. So, our current chief nurse executive, which is our vice president of nursing, is another title for it, was hired quite some time ago at Mercy General. She was hired as a new grad. So, she has started with us in a new grad position. Worked as a staff level for quite some time, became a supervisor, then a manager, and then a director, and then a senior director. And now she runs our nursing program at that facility, which I just love that. I love her story. It's great. She has never been employed by anyone else. She has been at that one site, and she has taken it from the beginning to the top. She'll probably, well, hopefully she'll always be there, but she'll most likely go to the corporate office and become some sort of system or regional. But I like that one. Um, hmm. Oh, I saw something pop up.
Yeah, sorry, I'm slipping in the way. How do you recommend making your resume stand out as a nursing new grad, since most nursing students have similar clinical rotations and experiences?
That's a good question. That is hard. I would say, I mean, there really isn't anything specific that you can do to catch the eye of someone, especially if, you know, it, if the new grad position is, say, an ICU new grad, other than saying, here are all my ICU clinical rotations, the one thing I can say to that, I kind of mentioned earlier, is when you're in your clinical rotations, get that contact information and reach out while you're in the clinical rotations. You're already making relationships and connections with a lot of these nurses and these nurse managers. And, you know, a note when you're ready to join the workforce, or a note when you're about to be ready. You know, if you're graduating in December, it's not too crazy to go ahead and send that message now, because they may not have the position posted yet, but they can give you an idea as to when and build that relationship again. You know, it's been 2 years since I did my rotation there, but I just wanted to say, hey, I'm almost done now. You know, I enjoyed X or Y of my rotation with you, and if you have something in the future, I will be applying, so please keep an eye out for me. That the connection based on networking that you've done in the past is the ultimate kind of standout experience that I could recommend, is just to do that.
And someone is asking specifically, so here's some network in action. Would you have any contact for me to contact regarding specific questions in the safety department?
I do not. And that one's kind of boggling me. I'm not familiar with a safety department. We may just call it something else. I mean, that what immediately comes to mind when I think safety department is our security team. I guess I'd want to find out, where did that program come from? So I'm assuming it was Connection, Occupational Health, and Safety. Well, see, now that's
And I
further.
think that's because that's the language here at Sac State in terms of the study that they do. So,
Oh, I
and
see.
how that would translate maybe to the hospital setting with that skill set.
Okay.
Where that might land might help. I don't know.
Mm-hmm. And it could be something that is a clinic and not a hospital job, which I'm less familiar with. We have a lot of United titles, but then on the clinic side, they may specialize in one thing. And so that whole clinic is occupational health, and they serve all of our region, but I might not be familiar. Oh, public health. Um, so we have a public health department, um, and it would probably be along the lines of occupational health as well. Yeah, I think I'd need a little bit more research. I don't have a contact off the top of my head, but I have a good resource. So LinkedIn, if you're not already on LinkedIn, I highly recommend it. It's just a really great way to connect with employers, and they have a really good search capability. You have the ability to use their search bar as if it were a Google search. So if you're familiar with the and or not Boolean searching terms, you can easily find any person that you might be looking for. You could type in dignity health, um, public health, and it will show you everybody who works in public health for our organization. And then you can narrow it down further and say director or manager or whatever it might be, coordinator. So I would recommend that as a starting point. You're welcome. But also, Mary, when she sends out the news afterwards and the link for this, will also have my contact information. So, if something comes up and you see it and you're not sure, you can always reach out. I do not mind answering questions as much as I can.
Thank you, Stephanie, for that. And
Sure.
I just want to put a shout out to that, because coming from the Career Center and having sat in on many, many, many employer sessions, what Stephanie is talking about now is definitely gold for your job search, getting those connections and reaching out, and you can find out information from people and you're building relationships. And that is often the differentiating factor for people in making their job search more human, for one thing, but also it helps you get in. So thank you for sharing that, Stephanie. That's awesome.
Sure.
There is a question here. If we apply at one Dignity location, does it also show at other locations nearby? Should we apply at each location?
That is a great question. So, when you apply to a position within our organization, you are in our system and you're searchable. So you can be found if a recruiter were looking for more candidates. However, if you have not applied to each position of interest, and we have enough, we wouldn't go searching. A good example is I had an executive coordinator title. I got a lot of great candidates, so I didn't need to go looking for anybody else because the candidates that had applied were great. They were a great match. And I know for a fact that there are a lot of talented executive assistants, executive coordinators out there who just maybe didn't see the job. So unfortunately, when you apply to one, it does not make you a blanket application for all. We're gonna make you do it over and over again until that connection matches. But it is pretty easy. Once you've got a profile in, the next time around, all it wants you to do is go through the information you've already provided and just make sure it's what you want it to say. If you're applying for multiple job titles, you may want to change a few things, but for the most part, you'll just click next, 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 and then submit. It'll take just a couple of minutes. And you can do it from your phone.
Nice.
Mm-hmm.
Another question, Stephanie. Do you hire international students for internships?
We will hire international students. I cannot answer specifically for internships just because I don't know how many internships we have. I know we hire a lot of administrative fellows, which is different than an internship, but you know what? I'm not 100% sure. However, international students, anyone working on some sort of TN visa or H-1B visa, we would consider. It's not a deterrent for us.
Great.
Mm-hmm. Did we get up to date?
Bunch of thank yous in here as well. So thank you, Stephanie, for all of this great information. And I don't know if maybe there's any other questions, or if students need or want any assistance around the application process. Or Stephanie, I'd love to hear your feedback on how that works. In general, people find it fairly easy to use. Once you load all your information in there, you can sort of cut and paste around and apply to different opportunities, it sounds like. I don't know if there's anything else you want to share on what that process looks like.
I think the most unknown thing about our application process is, and this is probably the hardest part for anybody looking for a new job, because you're not just going to apply to Dignity Health. You're of course going to apply to all of the titles of interest, which could be multiple companies, and then juggling all of their different websites. I really wish, since most of the applicant systems are utilized by the same company, I almost wish they had like a one-stop shop. You know, yeah, I applied to Sutter and UC Davis and Dignity Health, but they all use the same program. Can't you just tell me where I'm at on all of those? But they don't. So maybe one day, you know, I'll take a software program course. I don't know. And the only thing I can mention about that is once you apply, give it a few days and then just do a quick check-in, because you can often see the response as to what's going on. I think our system is pretty detailed. If you are in recruiter review, it will say so next to the application that you've put in. If you're in hiring manager review, it will say so. Generally, hiring manager review, that's probably where it sits the longest, because most of our managers are working managers, and it's a catch-22. You are much busier when you're looking for staff because you are low on staff, and so you don't have the time to stop, consider the resumes provided, and then make time to connect with those people because you're low on staff and you're too busy and you need this position filled. So give them a little bit of time to move that along to the next step, which would be interview. And you can see those statuses when you log back in and check your submissions. The interview status will usually say interview pending, and that means that we're working on creating a schedule, and then we'll be reaching out soon. And then it'll say interview confirmed. Of course, if you see an interview confirmed and you have no idea when that interview is, yeah, you should probably call us, because we may have been trying to reach you and didn't, or I don't know. It would be strange to see that and not know what, but that's the only information or the only advice I can give you. Once you apply, just take a look and see where you might stand afterwards.
Thank you. And we have a question. Can we share our resume to you for feedback?
Oh, yes, absolutely. I mean, generally what I'm looking for, I am looking for layout of information. If it has your name and contact information, I'm already giving you 10 points, because a lot of people don't. And so I don't know how to get a hold of you, and your resume looks great, but you didn't give me a way to call you. So I got to move on. So please have that on there. Your name is important, but mainly just to identify whose resume that they're looking at. If you use a first name and a last initial, that's fine. You know, we don't need the full name if you're not comfortable giving it. We'll get it later when we offer you the job. Having a clear layout of your past experience, you know, the name of the company, so that we can see what industry you worked in, the title so we can see what you did, and then the dates so we can see how much experience you got out of that is great. If you don't have work experience, using your volunteer experience, or you know, any deep dives you've taken on classwork. I mean, certain programs offer elective classes that you could take, and we want to know, you know, did you take extra classes on top of, you know, the required, so that you could really focus on something or really specialize in something. I think you should sell that. Any programs that you have that are out of the norm, you know, your Microsoft Word, Excel, Outlook, having that on there is important. But if you also work with Tableau, which is kind of like an Excel program, or if you can create a PowerPoint presentation like no one's business, put that on there. That's really good information to have, because it could be very desirable to that hiring manager. But as far as format goes, how you put it, where you put it, it doesn't really matter as long as the information's there. Um, Never ever leave off your education. It is very valuable. Having a bachelor's degree, having an associate's degree, having a high school diploma, it shows that you've achieved something that not everybody has, and you should definitely shout it out from the rooftops. So put that on there too.
Right. Another question, and we have about 5 more minutes left, so we're doing pretty well. How do you suggest, how early do you suggest a soon-to-be graduate start applying and looking for a job?
I mean, if it were me, I would probably do it within 6 months of graduation, but I think that's overkill. Um, as soon as you've kind of pinpointed where you'd like to be. So if that's 6 months to graduation, if that's, just a few months, if that's a few weeks, then that's ample time. Depending on the title, it could not be, it might not be around in 4 months. That's another reason why if you see it now and you're 6 months out, just apply to it. The worst they can say is, oh, you need to have this now, and if you're not done with your degree, then we can't consider you. But most of our hiring managers will see your graduation date. If it says May 2021, it's pretty close, and by the time they get through their interview process, we have the holidays coming up. It very well could be a May start date for a lot of people. So just go for it as soon as you can, as soon as you see it.
Good advice. Just a couple of minutes left. Any last question out there from anybody? And
Actually,
yeah.
I'm going to build on that as soon as you see it roll. I know it takes a little bit of time to apply to multiple jobs and to put it out there, but if you see something of interest and you're like, oh, well, maybe I'll try it for that. Just apply to it. I mean, what the worst case scenario is, they find a different candidate as a match. But the best case is, you've got your name in the hat to be considered and they choose you for the interview. So take the extra time to apply to any and all positions of interest. Don't be scared. If you're not quite a perfect match to the qualifications, maybe something is more valuable than another thing that you may not have. So just go for it. They'll let you know if you're not a good match or not.
And if someone applies for a job and they don't get it, should they apply again?
I think so. I'm probably annoyingly tenacious, though. If I want to work somewhere, I will probably continue to apply until I do. But also, unless they give you information as to why you were not considered, most email communication will tell you, oh, an internal got this. So it really wasn't you, it was them. They hired somebody in the company already. So definitely try again. If the response is, we didn't see the qualifications match, well, then next time you apply, take pieces of the job description and just make sure it's very clear and visible in your resume, and that connection could probably happen faster. So yes, apply again.
Yay, thank you. I don't know. I'm going to put a little note up in the chat. Sorry, I'm going to put a note up in the chat just for everyone so that students know there's resources for you at the Career Center to help with a lot of the subject matter that Stephanie talked about today. So it doesn't have to end here in terms of resume and all of that good stuff. So please use our services. But in closing, Stephanie, I don't know if you'd like just to share what you like best about working with Dignity Health and as kind of a takeaway, because I'm always curious what makes you like your job and why you're there.
That is a good question. I mean, for me personally, I like the autonomy of my role specifically. I like that if I feel something is really important in our process that needs kind of a revision, I like that I can openly suggest that and then see action taken on it fairly quickly, which makes me feel listened to, it makes me feel heard and seen. But the number one thing is I really like my coworkers. There's a lot of us and we're all very similar. And honestly, somebody could offer me more money to go work for someplace else. They could. I have a perfect example. My husband worked for Facebook for a while, so we moved to Mountain View, and I chose not to pursue any positions in the Mountain View area, and I commuted to Sacramento because I like them so much. So yes, I like my team the best.
Wow, that says something. That's a commute.
Oh, it was
Yikes.
terrible. It was terrible, but they are
Well,
worth it.
nice, nice, great testimony. Well, thank you, everyone. We're at the 1 o'clock hour, so we got to scoot. Although I'm happy to stay on for a few minutes if anybody wants to chat or if Stephanie has time. But in respect of everybody's schedules, thank you so much for coming today. Please be sure to tap into the Career Center if you need more assistance for all this. Stephanie's shared her contact info with you, and I will send a follow-up email as well to everyone. So stay tuned. This is the first of 6 Meet the Employer sessions that we're offering in the next 2 weeks, covering a wide range of industries. This is our primary healthcare partner, although we do have Blue Shield of California, which is more on the business insurance side, coming at the end of the session. So if you like connecting and meeting with employers in person, check out our Meet the Employer series. And thank you again for coming.
Yes, thank you for having me, and thank you all for hanging out and hearing me talk for a very long time. I appreciate you.
Thank you so much, Stephanie.
All right, have a great day. If anybody needs me, just let me know.
Got it. Thank you.
All right,
Have a
bye-bye.
great afternoon.